President of the Arc of California is a volunteer position, requires a 2-year commitment, sometimes a second term, which makes it a 4-year commitment. Let's see, I was a 4-year. Dwight Stratton was the first president to do 4 years, which meant when I was president, he was the longest running immediate past president in the history of the organization. Both of us are here. Pat Heineke, she was a 2-year president some 10 years ago, still on the board of directors. Pat Hornbecker is in the room. I saw her a minute ago. She was at the registration desk today. She's still involved in the organization. Clearly what happens is the ARC gets into the blood of those who serve and never, ever, ever lets you go. I suspect that all of us past presidents, though, agree that there has never been anyone in the president's chair with so much know-how, drive, and energy as exhibited by the woman currently holding the position. First of all, she's a parent of an adult son named David, so she's familiar with the challenges of being a parent, of going to IEPs, understanding the various service available and all the things that you have to do to get them. She's had experience with seemingly every facet of our community, and that's invaluable as we sit around and determine what bills to support or what issues to get behind. We want you to meet her, and we've asked her to introduce our next speaker. Please welcome the president of the ARC of California, Betsy Cates.
Thank you, Dick. This conference is a high point each year for those of us on the planning committee. It's our opportunity to bring to you a forum for you to hear from top experts on a range of critical challenges facing our community. Our purpose is to deepen our understanding of issues and possible solutions, to create opportunities for you to network, and to encourage you to reach out to your elected representatives. So for the next 2 days, please listen and learn, ask questions, get to know the people at your table, come up to the evening receptions and network, and then please go visit your legislator to make sure that they know what's important to you. So, and then armed with that knowledge and inspiration, continue to advocate and be involved. So thank you for being here and for your commitment to people with intellectual and developmental disabilities and their families. And I am pleased today to be introducing Peter Berns, who is the Chief Executive Officer of the ARC, the world's largest community-based organization of and for people with intellectual and developmental disabilities. He has been at the helm of the ARC since July 2008. Before that, he was the executive director of the Maryland Association of Nonprofit Organizations. As a public policy advocate, he was critical to reforming state and federal Medicaid regulations, improving life for people with disabilities and their families. He was named to the Nonprofit Times Power and Influence Top 50 list in 2000, 2002, 2003, 2004, and 2005, and again in 2015. In May 2011, President Barack Obama appointed him to the President's Committee for People with Intellectual Disabilities, which provides assistance and advice to the President and the Secretary of Health and Human Services on topics important to our community. So please join me in welcoming Peter Berns.
Okay, good morning, everyone. Let me see if I can have a PowerPoint. Let me see if I can get it up here. Oops. I can get your cursor over. Oh. Yeah. Nope. Try again. Nope. One more. I think it's in the next one. Okay, nothing like starting off a presentation with a little technical difficulty. I really should title this more National Outlook than National Update. I am going to provide a little bit of a policy update, but you are going to actually have the privilege of being the first audience to get a sneak peek at the results of our FINDS survey. It's a nationwide survey of family and individual needs for disability supports that the ARC does in collaboration with the University of Minnesota. And so you'll get to think a little bit, I'll be sharing some information about what's happening with individuals with intellectual and developmental disabilities all across the country and their families, their parents, siblings, other support providers and caregivers. And you think about how to think about what's going on here in California in comparison to the nation. I came to the ARC 10 years ago, and I really appreciate Jackie's comments about the need to be outraged. Because when I came into the ARC 10 years ago from outside the disability community, I could see really clearly the amazing progress that had been made over the course of the ARC's history, and yet still saw how challenging conditions still were for people with intellectual and developmental disabilities, and how we hadn't yet achieved the goals of inclusion in our community. Now 10 years later, I can see the progress that we've made over the past 10 years, but the fact that we still do have a long way to go. And you heard a lot about that from the panel this morning. Now, in terms of some of the national policy, since I was here last year, it's been a pretty busy year. And the way I generally describe the past year is that we have been fighting to prevent the dismantling of everything that this organization and the disability community has worked to build over the last 70 years. And we did have some successes. I believe was it Aaron this morning who was talking about the fact that we beat back efforts to decimate the Medicaid program as part of the repeal of the Affordable Care Act. But the Congress did go ahead and enact, and the President signed the Tax Cuts and Jobs Act, a big tax reform legislation, which does have the impact of putting a $1.3 trillion hole in the federal budget over the next 10 years. That is creating enormous pressure to cut entitlement programs. And you've heard Paul Ryan talk about that. You see that in the President's proposed 2019 budget, where the President is proposing significant cuts to both discretionary and non-discretionary spending. There have been some other, and you see that in the budget deal that was enacted by the Congress, which covers fiscal year 2018 and fiscal year 2019 spending for the federal government. That budget deal is going to lead to another $320 billion increase in the deficit just over the next 2 years, creating more pressure to cut entitlement programs, what they refer to as entitlement programs, which are programs that we know are essential to support people with intellectual and developmental disabilities in the communities. There are a couple of other interesting things that have happened over the past year in terms of federal policy. One was that the President signed after Congress passed something called the RAISE Family Caregivers Act, which will create an advisory body that is charged with developing a national caregiver strategy. We have CMS approving for states to impose work requirements as a condition of receiving Medicaid, and a couple states have taken them up on that opportunity. We have the Congress, the House, not the whole Congress, the House passed an effort to reform the Americans with Disabilities Act, which actually really takes the teeth out of the Americans with Disabilities Act, but that hasn't been passed by the Senate yet, and hopefully won't if we all work hard to prevent that from happening. You may have not seen that the President's Committee for people with Intellectual Disabilities just came out with a report that is focused on the direct support workforce crisis, and I would commend you to take a look at that. So let me talk a little bit about fines, and I have a lot of slides I'm going to share with you, and we'll make these slides available. We haven't published this report yet, but the ARC and the University of Minnesota did the fines survey for the first time in 2010, and had occasion then to field it again in 2017. We are about to release this community report, which has a portion of the data, not all the data, because there's just simply too much data, but we're going to make all the data tables available, and we're going to be coming out with some other reports and fact sheets over the course of the next year. This is not fake news. We're going to share the facts, okay? This is the truth, okay? And part of the objective in doing this research is to make sure that the work that we do together, both the public policy advocacy as well as the program work that we do, that it's all well informed by what our constituents are experiencing and what our constituents say they want for the future. There are 7.2, the latest estimates are there's 7.2 million people with intellectual and developmental disabilities in the United States, and only about 1.2 million of them actually receive services through state developmental disability agencies. So lots is known about the folks who receive services through the agencies. There is much less known about the other 6 million people who don't receive services through state developmental disability agencies. And that's one of the real important things about this research, about the fines research, is it really is the only nationwide study that tries to look in depth at what is the experience of the entire universe of individuals with intellectual and developmental disabilities as told by their parents, siblings, or other support providers or caregivers. I'm going to use the phrase caregivers just so I don't have to keep repeating support providers or caregivers. But that's one of the things that's important about this research. Really sheds a light on what's happening with folks who are outside the system. Our survey included about just under 3,400 folks from all 50 states, DC, Puerto Rico, Guam. This is a survey that was completed by the support provider or caregiver. 87% of the survey respondents are parents, 6% siblings. They described 73% support adults, 43% children, 16% both adults and children in their household. 50% of the caregivers were between the ages of 50 and 64, 17% ages 65 and above, 89% white. We were not able to achieve a truly representative sample in terms of race and ethnicity, only 11% non-white. We couldn't slice up the data to look at different ethnic groups. And the way the University of Minnesota did this is they took the 3,400 folks and they developed different representative samples, so we're able to say that their analysis represents the universe of caregivers in the United States. So who is being supported? 63% of the family members were male, 83% white, 17% non-white, average age 25, the range in age from 1 to 89. They looked at disability type and divided the group up between folks who have intellectual disability, that's the blue part of the pie, folks who have both intellectual disability and are on the autism spectrum, that's the red piece of the pie, folks who identify only as having autism spectrum, being on the autism spectrum, 25%, the green part of the pie, and then folks who have other disabilities but do not identify as having intellectual disability or being on the autism spectrum. That's about 17% of the pie. And you'll see in the report, and I'll pull out a couple areas where we see differences in these groups in terms of what their life experiences are. So first let's take a look at some of the experience of individuals with intellectual and developmental disabilities. And as I described, this is a survey where it's the parent, the sibling, or the other care provider who's reporting on the experience of the individual they're supporting. It's probably appropriate to start at school. We have a commitment in our country, purportedly, to provide a free, appropriate public education in the least restrictive setting for students with disabilities. And what you see in this chart here is what that experience looks like in kindergarten, primary school, middle school, and high school. The blue bars representing individuals who are being educated in separate schools or classrooms, the red bars who are described that they're partially included, and the green bars that describe that they're fully included in school. And what you can glean from this chart is that the older you get, the student gets, the less likely it is they're fully included in school. You can see that downward red arrow. You can also see that the older you get, at least between primary school and high school, it's more likely that you are going to be educated in a separate school or classroom. So that's not what we want to be happening. That's not achieving the goal of a free, appropriate public education or the goal of inclusion in our school systems. And if you look over the 7-year period between the first FIND study and this most recent FIND study, we see some troubling trends. You can see the downward red arrows. What we're seeing, for example, in primary school, in middle school, and in high school is a decrease in the percentage of students families who are reporting that their student was fully included in school. And we're seeing an increase, so it's a red downward arrow because it's bad news, an increase in the percentage of students who, particularly in middle school and in high school, the percentage of students who are being educated in separate schools or classrooms. And so in a sense, we're seeing a move to the middle, more students educated in having school experiences where they are only partially included. We're seeing in our survey a lot of dissatisfaction reported by parents. Close to 4 out of 10 of caregivers report that they're dissatisfied with the experience their loved ones, their sons or daughters are having in school. We're seeing 50% leaving high school without a diploma, only about 37% who are achieving a diploma. And we're seeing families report that the caregivers report, lots of folks, 40%, are involved in supporting the individual to arrange child care and after-school care. We're finding this to be an area where a third of the families report it is difficult or very difficult to arrange after-school care and child care. About a third saying, about 30% saying, we need more support. Our loved one needs more support in this area. So still a lot to do around education. If I turn to work, what we saw in the FINDS survey here, if you look at the center of this graph, of this chart, 36% report that they are employed, that the individual with disabilities was employed full or part-time, and of that group, 76% report that they were earning at least the minimum wage. That is an increase from 2010, both the employment and the percent reporting that they make a minimum wage or better. In the earlier FIND study, we documented only 15% of individuals reporting that they were employed. Among those who aren't employed, we have large percentages, a large percentage, nearly half, who report that they'd like to have a job. One of the interesting things, though, when we delve a little bit deeper here, is on average, the folks who are working are only working 26 hours over a 2-week period. So about 13 hours a week is the employment that we're capturing in the survey here. And very few, less than 1 out of 5, are getting any employee benefits whatsoever. Where are they working? About 60%, close to 60% if you look at the left-hand pie chart here. Close to 60% report that they're working in integrated jobs in the community. About 12% in group-supported employment, 6% self-employed, and 24% in facility-based employment. And you can see on the right side of this chart the range of work that they're doing. Still about a quarter involved in janitorial and landscaping, 20% in food service, roughly 20% in retail, but a variety of other types of work as well: animal care, child care, office work, 24% in other, lots of different occupations. By and large, folks are really satisfied. The folks who are working, or at least their caregivers, are reporting that they're really satisfied. Vast majority are satisfied with where they work, they're satisfied with the type of work they do, they're satisfied with their pay. We intend to do some further analysis to look at whether there are differences in satisfaction based on setting and the like, but overall the picture is the folks who are lucky enough to be employed are happy with the fact that they are having those opportunities. Our caregivers report, a lot of them report that they are involved, 57% report that they're involved in providing support for their loved one relating to their employment, career, and educational opportunities. And for 4 out of 10 of them, that it's difficult or very difficult to do so. And for 55% of them, that more support is needed. 59% overall report that more supports around day service and employment are needed. 38% report that more support is needed around integrated community employment. So what are folks doing if they're not working? We asked that question, and what we found is that 28% are staying at home. 48% are involved in unpaid facility-based activities, meaning they're not getting paid. And from what we heard, the providers are barely getting paid. 48% in unpaid facility-based activities, 24% in unpaid community-based activities. And here we're seeing some disparities. If you're, in our sample, we were able to divide up between lower income folks below the 59,000 median income in the country and higher income. And what we found is that if you're lower income or if you're non-white, you're more likely to be sitting home, staying at home, than to be out in the community or to have other day supports. 80% of our family caregivers describe that this is one of the areas that they're active in in providing support. And for 62%, they're saying more support is needed. 85% report that finding non-institutional community-based support is either somewhat or a major problem. Let me turn next to where people are living. What we learned from the FIND survey this year is that 80% report that they are living with their parent or other family members in their family homes. So for the other 20%, if you look at the left side of the chart here, for the other 20%, you have just over a third, 36%, who are living in their own home, 23% who are living in a group home of 4 to 6 people, 16%, the red bar, living in someone else's home, 12% living in a smaller group home, 3 or fewer people, and then a number in a variety of other settings. Now I want to point, on the right-hand side of the chart, we asked a question here, what's the ideal setting in the future for the individual to live in? And 52% said, 48% said the ideal is where the person lives right now. But there are 52% who said, no, the ideal is not where the person lives right now. We think they would be better off living in a different type of setting. And of that group, the folks for whom where they live right now is not ideal, 28% said living in their own home would be, their own home that they rent or own, that would be the best arrangement for them. 18% said a group home, 3 or fewer people. So substantial interest still exists in small group home settings. One of the real interesting findings here is you look at that 30% bar. That 30% bar is folks who said that an integrated, intentional community where people with and without disabilities live in some collaborative fashion would be the best choice for our loved one with disabilities. If you go back to the left-hand bar, you can see the 1%. Nobody's living in that type of setting now. Only 1% report that they're living in that type of setting now. So a lot of interest in this, as yet, I think, undefined concept of what is an integrated, intentional community. If you look one bar to the right of that, of the 30%, you'll see a blue bar that has 4%. The option there was disability-specific housing, a community of only people with disabilities. And that's some interest, but very low interest. The interest really is in the integrated, intentional community. I mean, the two largest areas of interest are integrated, intentional community, or someone living in their own home in the community. Who do they want to live with? Well, only 8% want to live alone. 4%, the blue slice of the pie, want to live with someone they choose. 37% say that they want to live with one or both, that the ideal setting would be one or both parents while living. I suspect we might see a little difference if we were asking self-advocates this question as opposed to asking the parents this question. Who wants to live with one or more parents? But just a possibility. Okay, so let me turn to the challenge that the parents, siblings, other caregivers are experiencing. We learned a lot about this from the survey. Folks are stressed out. Probably not a real surprise finding. 48% reporting that they are extremely or very stressed. Only 6% saying they're not stressed at all. That 48%, I would mention, is an increase in the reports of more severe stress since the FINES 2010 survey. Why are they stressed out? They're working long hours. On average, 57.4 hours providing support. The difference in the bars, the color of the bars here is the lighter orange is the hours provided supporting an individual with disabilities who is a child versus an adult. And I think that's probably to be expected, that we would think a child would be in need of more support than an adult. But even for the adults, you have nearly 40% of the caregivers reported that they're spending 80 hours or more a week supporting their loved one with disabilities. As I said, the average is 57.4 hours. So what are they doing? Okay, here we get into little jargon. Folks probably know a lot of you probably know what is an IDL and an ADL and IADL. It's activities of daily living and instrumental activities of daily living. Bottom line, folks are doing a lot of different things providing support. On average, 3 activities of daily living, 8 instrumental activities of daily living, and the like. But what's the most difficult? So we ask folks, what are they doing? And then we ask, is it easy? Is it difficult? Is it very difficult? And so here's the top 5 in terms of very difficult and very difficult. Finding respite, finding PCAs and DSPs. I mean, not a surprise what we've been talking in terms of what we've been talking about this morning. Crisis prevention, managing difficult behaviors, arranging for and managing benefits, employment related. There are 10 other types of service support that were rated as difficult or very difficult by at least 3 out of 10 of the survey respondents. Where is more support needed? Well, pretty much everywhere. But the top 10 are on this chart, and you'll see it's supporting advocacy It's arranging social and leisure activities, finding specialists, arranging and managing benefits, and the like. So lots of different support are needed, and these were all by at least, everything on this chart was by at least a half of the participants in the survey. So why are people struggling to find support? We asked, are supports more or less available? And what we see is potentially a glimmer of hope. If you look at the little yellow star there, fewer folks reported that services were decreasing in 2017 as opposed to 2010. More reported things are staying the same. Not many reported that things are improving in terms of service availability. Now, this is not quite as relevant in California because of the Lanterman Act, but nationwide, we had about 28%, if you look at the chart on the right side, 28% say they're waiting for government-funded services, with 20% of those saying they've been waiting for 10 years or more. Another 20% saying they've been waiting for 6 to 10 years. Areas where more support is needed, the kind of red-colored bars in the center show the areas where that scored the highest in terms of more support being needed. The green are areas where folks said, I either have it and it's enough, or I don't have it and I don't need it. And so you see, the top 5 are helping with mental health care, helping with finding inclusive programs, in-home supports generally, helping with navigating and planning services, helping families connect and support one another. So if you think about areas where you in your work, what's the need that still exists to be filled that you really could be helping the families, those are what are identified as the top 5. Things are financially draining for families. 17% report spending more than $10,000 a year providing support. How do they pay for it? They're using the meager SSDI and SSI that they may receive. They're using the family's personal income and savings. 52% in our sample get Medicaid waiver funding of some sort or another. 55% actually were getting some support from private insurance. It's probably for some of the health care services. So I'm going to, oops, went too far. Caregivers, when we ask them about their personal lives, they're describing lots of challenges, meeting their, this is 7 to 72% and above. Challenges meeting their personal needs, challenges balancing responsibilities, challenges dealing with breakdowns in support, etc. Challenges with meeting my work responsibilities, challenges with having enough money to pay for everything that I need. But there's another side to that coin, and that is folks are reporting some positive experience from being a parent or caregiver. They've developed new values about what's important. They enjoy helping other families. They spend more time in family-oriented activities. They feel fortunate to have this life experience. So I'm going to dig deeper in the time I have left. I want to dig deeper in a couple areas. First, future planning. What we're seeing in the survey is that more than half of the caregivers report that they don't have a plan for the future for their loved one, their son or daughter, or family member with intellectual and developmental disabilities, and they're very worried about that. They're very worried about the consequences of that. What will happen when they're not there to support the individual? Will the quality of support decrease? Will the person not have enough friends in social activities? Will their health deteriorate? Will they experience abuse? Will they be financially exploited? Will they have to live somewhere that they don't want to be? So this is still a major challenge we face in our community. Real problems around social engagement and social isolation. We had 91% of the caregivers say that that's one of the things they do is support arranging social and leisure activities, that it's difficult for a third of them, that more support is needed, and they consider this to be a major problem area. Somewhat or major problem, 85% helping their family member to find inclusion in inclusion in all aspects of community life. One of the exciting pieces of news that we see is we have an opportunity. We have an engaged group of folks. We asked folks about their involvement, and one of the things we found, 8 out of 10 said they're more confident, assertive, and effective at communicating. 89% more aware of policy issues. 82% more involved in advocacy. 74% report that they call their legislators. So they're not just thinking about it, they're picking up the phones and they're acting. 95% say they vote. Anybody know what the general voting is, general population? I think it's something around 57, 60%. 95% of our folks vote. Okay, when you're talking to legislators in the state capitol on Tuesday, you tell them that 95% of our folks vote. And this is an area where the caregivers say they'd like to see more support available. 93% describe they support their loved one with advocacy and self-advocacy. 66% say more support is needed. 97% said it would be helpful or very helpful to provide better ways for caregivers to bring concerns to policymakers and legislators. So think about that. What can we do to provide better ways for caregivers to bring their concerns to policymakers and legislators? So let's talk for a minute about what life is like for the caregivers in their own jobs. Okay, 63% of our caregivers reported that they had, of the survey participants reported that they had jobs in the last 12 months. 80% reported that they had worked at some point during their experience as a caregiver. 95% say being a caregiver has impacted their work. They have, for example, had to cut back on go in late, leave early, cut back their hours. 42% said they had to take a leave of absence, and that was greater for folks who were non-white, 52%. We had, just about 35% who said they had to quit their job. We had folks turning down promotions, folks reporting that they couldn't move to pursue an opportunity in another state because Medicaid's not portable. We had 24% say that they received warnings about their job performance because of situations relating to their caregiving, and that was higher for folks who were non-white, a full third of people. So it's interesting to think, what more could employers do, or what more should we be asking employers to do to support employees who are caregivers? Caregivers for people with disabilities in particular. What the survey respondents tell us is that they get some benefits, but wouldn't it be great if we could, if caregivers could get paid for some of the hours that they provide support? Wouldn't it be great if we could get an income tax credit or deduction to offset the cost of care? Or if we could get more paid leave? Or wouldn't 82% thought it would be a great idea if they got help from their employer as an employee benefit, help navigating the system, the special ed system or the adult system? 76% said an employee assistance program that provided case management services would be helpful to them. So we spent a lot of time thinking about what the government should do for our constituents, but let's also think about what the private sector should be doing for our constituents, and let's engage the private sector in dialogue about that. We asked a series of questions about autonomy and self-determination. We found 58% of those above 18 were reported as having a court-appointed guardian, and guardianship was more likely among people who had both intellectual disability and who were on the autism spectrum, 73%, and it was least likely for those with other disabilities. We asked folks, did they explore alternatives to guardianship? They said yes, that they explored a variety of different alternatives. About 36% say they explored supported decision-making, 40% power of attorney, 60% using representative payee. What we see is also in the survey is folks trying to support their loved ones in person-centered planning and self-determination and self-directed services. So 76% reported helping their family member obtain person-centered planning support. But then this too, 57%, this is an area where more support is needed. And only 33% reported that they were involved in supporting the person in taking advantage of self-directing services, even where self-directing services were more widely available to them. So, lots of data here. We're going to be issuing reports. We'll share these slides and other information for you. I really urge you to think about it in a couple ways. One, we've got a lot more work to do. So let's celebrate the progress that we've made in the 68 years of the ARC's existence, in our last 10 years of work together, our last year's work together, but let's reaffirm and recommit to the work that we still have to do. I think what the survey tells us is that our advocacy is on target. You know, that we're focusing on a lot of the right issues. You know, the one area I think that really jumps out, though, is in terms of new opportunity, is let's not put all of our eggs in the government funding basket. Let's be thinking aggressively and creatively about how do we more effectively engage the private sector. And that could be around getting more jobs for folks with disabilities. It could be around getting more supports for employees in a workforce for the employee who is a parent or caregiver. Take some of the pressure off the individual. And let's focus on movement building. We've got a constituency that is engaged and poised to do more, and we haven't really amassed all the power that really is at our fingertips. The parents, the siblings, and the self-advocates are a force to be reckoned with, and we've got to work together to unleash that power. So thanks very much.